Hi, I'm visiting with Dr. Hajal at the Sleep Center, and we're talking about sleep disorders. Dr. Hajal, shift workers, they must have a lot of trouble with their sleep stages, and can that lead to a sleep disorder?
Absolutely. There are some people who would do shift work and can tolerate it pretty well, reasonably well, because it's not a normal pattern of sleep. But there are some people who do very poorly with shift work. And if you have to do work at night and you're unable to function, unable to recover, it becomes a disease in of itself called shift worker syndrome.
Oh, all
And
right.
there are things that you need to do, but all shift workers should be cautioned about, for instance, driving in the morning. If you worked at night and you're driving in the morning, you're almost at 3 times risk to get into a car accident than if you work during the day and is driving to work. So it's, even though it's the same drive, your risk increases tremendously. And that has to do with the fact of sleep deprivation, not being able to function. And you're still working against the normal cycle. You don't get the sunshine that you need during the day because you have to be sleeping. And at night you're not able to get that. And also people who sleep during the day frequently feel the pressure to go on and do other things. They cut themselves very, very short. And the phone may ring at 2 o'clock in the afternoon, it may not at 2 o'clock in the morning, so you end up resting. And so people who do shift work have to take measures to make sure that they're resting well and sleeping very, very well. Some people darken the windows very well so they can get rest. Shut off the phone and make sure that they get enough sleep. And then there is also some light therapy that they can do, which means absorbing light as they're working helps them function a little bit better. And that's not regular fluorescent light, or not your average light. There are some lights that mimic the daylight, and this would help them function a little bit better.
Oh, like the machines for SAD?
Exactly, like the
Okay.
same one for the seasonal affective disorder. And they could use them during their shift and helps them function a lot better. They can also take a nap, a scheduled nap, very short, 10 to 15 minutes, and helps them function a lot better during that shift and keeps them away from getting into car accidents and trouble at work or accidents at work.
Okay. Well, thank you.